Hesitation and repetition are two of the most common problems experienced by candidates taking the OET speaking exam. So how do we deal with hesitation and repetition? Well, join me in today's video where we discuss how to avoid hesitation and repetition. Hi, my name is Richard Foster. I'm a trainer and assessor for Benchmark Education Solutions. Today we're going to talk about those two problems that most of us face at one time or another in an exam, and that's the problems of hesitation and repetition. So why do we hesitate? Why do we repeat ourselves? Well, let's start by considering the main underlying reasons for hesitation and repetition. First of all, hesitation and repetition are often tied up with nerves, aren't they? In fact, nerves can be both the cause and the symptom of hesitation and repetition. Let me explain first how nerves can be the cause. If you're already nervous before the exam, before you start the exam, then as we discussed in a previous video, video 9 in this series, where we talked about how to handle nerves, nervousness can end up paralyzing your thinking process. This results in hesitation because your brain simply isn't keeping up with what you're asking of it. And secondly, it results in repetition. It's as if your brain knows it's failing to move forward, so it does the next best thing. It goes back to the last known good thing it produced, the last coherent thought it remembers, if you like, and then you repeat it as if it's going to make things better. It's also made worse because of the pressure that you're feeling because you're having to perform this role play in front of a potential stranger, the interlocutor. And they currently hold your life in their hands, don't they? So what about the nerves being the symptoms or the result of hesitation and repetition? Well, let's face it, if you're doing something you know is specifically mentioned as something to avoid, then actually you end up doing it and you know it, and it adds to your nerves. It's like a vicious circle, isn't it? So what can we do about it? Well, the first thing is to tackle nerves head on. Don't try to avoid nerves. Try to find a way of dealing with it. I suggest you go back and look at video 9 if you're not completely familiar with some of the ways to overcome nervousness. But if you've already done that, let's move forward and consider the main reasons for hesitation and repetition. The first thing is often a lack of vocabulary, and the second thing is a lack of register. To be clear about the difference, for the purposes of the OET speaking exam, vocabulary is more about the words you use in everyday language, whereas register is more specific list of words that a healthcare provider might use more frequently or might even be unique to a healthcare provider's profession, a doctor or a nurse, a dentist. For the OET speaking exam, your vocabulary and register need to be those associated with your profession, but in English, in the English language. Therefore, if you don't have enough vocabulary, or more specifically, your register of English words that you as a doctor or a nurse, or for example, might use, then you're going to struggle to find the right words in exam conditions. This then leads to hesitation, repetition, and nerves. The OET examiners will often attribute repetition and hesitation to a lack of vocabulary or register. In turn, adequate vocabulary and register are two of the key things being assessed in the exam. They're part of the linguistic exam criteria. So what can we do about it? Well, actually, the first answer is very much about practice. If you enter the OET speaking exam with a poor vocabulary in English or a poor register that you can use in English, then you're already inviting problems. But there is a way to overcome a large part of the problem, and it's about getting smart. Let's split up vocabulary and register. The types of things you talk about will be quite small, or quite a small subset of your normal vocabulary that you would use in everyday speech. There will be general phrases and words you will use frequently and regularly in any type of conversation with a patient. For example, you might say, "Nice to see you. What brings you here today? How bad is the pain? Have you experienced this before?" These are all words and phrases from your general vocabulary that are more likely to be used with a patient, aren't they? You don't normally use these phrases or words in everyday language in the shop or at home. And then there's your register of words and phrases that are specific to your profession. Things like heart attack, inflammation, follow-up appointment, treatment plan. And then you can go a stage further, in fact, to include all the medical terminology like acute myocardial infarction, varicella-zoster virus. The point here is that you may be highly qualified and fluent in your native language and have a comprehensive vocabulary and register. But if you have a limited vocabulary and register in English, then you're going to face challenges in the exam. So there's two ways to focus swiftly and resolve the problem. I'd suggest you use the 80-20 rule. 80% of the time, you will use a very small list of phrases that are easy to remember, and then 20% of the time, you'll maybe use a larger range of words and phrases. Think of the top 10 or even the top 20 phrases you might use regularly in general conversation with a patient, and then practice each one of them. Then think about your register. Think about the specific phrases that are unique to your profession. Pick 10 or pick 20 and practice them. Now, the second part is to let me help you form a baseline. If you were to join me in a mock test, I can very quickly, at the end of that test, give you an idea of what level you're at with both the linguistic skills and the clinical communication skills. This sort of links to remembering to take up the full 3 minutes of prep time during the exam. So when you're in that 3 minute, think about those phrases. Think about those particular words that you've memorized and think about where you might use them in the exam. Remember the main stages the conversation may go through in the exam, and think about where specific phrases may be used. Think about the timing of things during the exam. For instance, greetings and introductions. What phrases might you use at that point? When you're echoing back to the patient, what might you be saying then? When you're asking the patient to summarize their understanding, what phrases or vocabulary might you be using then? Nerves, hesitation and repetition are common challenges to OET speaking test candidates. One of the best ways to improve your confidence right away is to let me take you through a mock test. And I'll show you all the things that you're probably doing really well, but I'll also help you form that baseline to help establish all the things that you may need to work on. So I hope that helped today. It's quite a lot of information. You may want to replay the video. But all of these problems, hesitation, repetition and nerves, can be dealt with if you plan ahead.